Hello there, welcome back to my channel. My name is Dominica Akiemi and I'm your neighborhood pharmacist. Thank you so much for watching my last videos, and if you're new on here, I'm going to ask you to please subscribe, like, and please share and recommend to your friends. So let's move into the topic of today. We're going to be discussing stomach ulcers, a pharmacist's guide to treatment and management of them. So what is an ulcer? An ulcer is basically a wound or a sore. So in this case, we are discussing about a wound or a sore in the stomach lining. Now, an ulcer can be called a gastric ulcer or a peptic ulcer based on the location. So it is called gastric ulcer if it is found on the lining of the stomach, or a peptic ulcer if it is found within the intestine, the earlier part of the intestine, the small intestine joining the stomach. So you can call that, it's called a peptic ulcer. So what are the causes? Why ulcers? Two basic reasons. There are other reasons, but these two are the most common reasons. The first one is caused by an infection of this bacteria called Helicobacter pylori or H. pylori. So what this bacteria does is that it feeds on the mucus on the lining, protecting your stomach from the stomach acids. So once it does that, it exposes the stomach wall to gastric acids. The stomach contains acids and is what is used it uses to digest our food. So if the bacteria eats through the mucus lining, it exposes the stomach wall to the acids, and therefore a wound ensues. The second cause is what we call, pharmacists called NSAIDs, non-steroidal anti-inflammatory drugs, which we commonly know as pain relievers or pain medications. Okay, medications under this group that cause ulcers: ibuprofen, naproxen, and all the medications on that, diclofenac, paracetamol, all of that, they are all non-steroidal anti-inflammatory drugs. So they can predispose you over time to ulcer. How? They also act on the mucus lining of the wall, in the sense that if you use this for so long, it could thin out the mucus and expose that area to the acids as well, and then a wound is what comes after. So that is what causes ulcer. Those are the two causes, the two common causes of ulcer that we have. What are the symptoms? Most people will tell you, if you have pain in your stomach within this area, from your navel to the lower part of your chest, sometimes the pain could extend to the back. I'm sure people that have had ulcers understand what I'm trying to describe. But if you have this pain that is not going and you don't understand, you could talk to your doctor about it. So what are the common symptoms of an ulcer? Pain within the abdominal region. Usually if it's a duodenal ulcer, the doctor will be able to palpate your stomach, or you can feel that dull pain sensation there. You can also feel the pain sometime around meal times. All of a sudden you are feeling, either you can't eat too much or you don't feel full, but there's this pain that is consistently there. Those are I'm just mentioning basic symptoms here and there, but the symptoms can be much more than that. It's left for the doctors to find out. So in this case, the doctor will ask you to run a test. So there are two kinds of tests. There's a blood test, there's also the stool test. So once it is confirmed that you have an ulcer, then the doctor can prescribe medications for you. So we go into treatment of ulcers. Now, there's the lifestyle changes, and there's also medications for ulcers. Now, what are the lifestyle changes if you are managing an ulcer? Alcohol and smoking. These two things. If you are an ulcer patient and you drink alcohol or you smoke, you will not allow that wound to get healed. Why? Because cigarette smoke slows down wound healing, same as alcohol. All right, these two things you have to stop if you want to treat the ulcer. Also, other things that would predispose you to having, making the ulcer pain much more, spicy food. I mean, why? I don't mean peppery. Yes, peppery. But if the food is too spicy, there's so much condiments and seasoning, it could actually trigger the ulcer. Okay, exacerbate it. That is, make it worse. Also, caffeine. Okay, caffeine in coffee or high caffeinated foods would also make your ulcer worse. Now, tomatoes as well. Tomatoes and citrus, all citrus fruits, oranges, they fall in that regard. Tomato as well, they are all acidic, so they will also make the ulcer worse. Another thing is high fatty foods. If it is deep fried or it contains excessive fat, all these things will trigger your ulcer and make it worse. So I need you to understand this when treating your ulcer. Once you've been diagnosed with an ulcer, these are the things that you should begin to curb until the ulcer is properly treated. Now let's go into medication treatment of ulcers. First time ulcer patients, the doctors recommend triple drug therapy, where there are 2 antibiotics, usually penicillin based, one imidazole, and then a proton pump inhibitor. So he uses these 3 to basically kill the bacteria as well as reduce the acid content in your system. The therapy is best recommended for 14 days. As much as possible, follow this recommendation. Finish your drug and use it till the end to completely eradicate this bacteria from your system and to prevent a reoccurrence. Okay, that's one. There are other medications that also can be used. We have the antihistamines. Okay, we have antihistamines the doctors can prescribe. We also have the mucosal protective agents. I'm sure you've heard of bismuth subsalicylate. So what this does is to cover that part, assist your mucosal layer to cover that wound until it is healed. Okay, so all these medications, there are different kinds, different classes. So you're asking, why is the doctor asking me to use this medication for 2 weeks? This is the reason why. Ulcer is not just stomach acid. Ulcer is caused by something, and that has to be eradicated. Also bear in mind, I want to mention this: do not use NSAIDs, don't use pain medications without a doctor's recommendation or a pharmacist's recommendation if you're an ulcer patient. Okay, there are medications, there are alternatives you can use when you have ulcer, so please have this in mind. Finally, probiotics. Okay, yogurts are good for you. Fermented foods, things like gari, pap, like I said, yogurts, they are all good for you. So these foods will help in helping your stomach, bacterial flora in your stomach. We have good bacteria in the stomach, so these fermented foods will provide a very good environment for them to grow and help phase out the offending bacteria that is causing the ulcer. Remember also to eat foods that are rich in antioxidants as well. They will hasten up your healing process. Okay, things like ugu, spinach, all these. Just avoid tomatoes and citrus fruits. Yes, they contain antioxidants, but we don't need them until the ulcer is gone. So foods rich in antioxidants, foods that are probiotics, they all help in hastening the healing process. I hope you were able to get something in today's video. Thank you for watching, and please don't forget to subscribe. Don't forget to hit the like button and the notification bell so that when new videos are out, you'll be aware. And then I want to mention something. There is going to be a video challenge. My producer has said that I must produce 1 video every day all through the month. So I need your help. If you have topics, if you have questions, if you have anything you'd like me to make a video around, please reach out to me in the comment section or on my social media handles. I will definitely work on them and post them. And please, we need to get the subscribers to 1,000, and that's the goal. I know you are there for me, right? As I'm producing premium content, please, as much as possible, supply the topics. Thank you. See you. Bye.